Unsung heroes of the pandemic, you rarely never hear from them, and yet they are literally the lifeblood in India's devastating battle to save citizens from the monster of the COVID surge. Here's a report.
The fight against coronavirus. It is a war that has lasted a year and is still continuing. Leading from the front are thousands of unsung heroes. "35-year-old Sherry, a nurse at Max Hospital, is one of them. Sherry has followed the same routine for a year now. She works for 14 days in the COVID ward, followed by 4 days of quarantine. Her daughter back home remains anxious for her safety.
Yes, sir. Yes, I have a child and 5 years old. Child is very much supportive to us. When I went back to home, and she is far away from me, and just I am taking hand washing, and then I take bath. After that, I took the child. She is very yes, she is very much understanding. जब हम पेशेंट को देखते हैं वो वेरी क्रिटिकल होता है, बट उन लोग उतना नियर पेशेंट को देखते नहीं है, इसलिए सब लोग मास्क वेयर करना है. इट्स अ वेरी वर्सल सिचुएशन and my request also all should wear mask and use the sanitizers and give cleaning.
For nurses, every day feels like a war. They step out of their houses with prayer on their lips, leaving anxious family members behind. If last year was tough, this year is unbearable. They all talk to each other, they talk to their family members, not just for moral support, but also for psychological support. These are very difficult times, and each and every nurse takes every day like a war. They believe they are going on a war front where their job is to save as many lives as possible.
सफोकेशन होता है हमें पीपी किट के अंदर, फिर भी हम एक पेशेंट का सेफ्टी के लिए करते हैं, काम करना उसको तो सेव करना होता है. All sirens are in Kerala and they are called up every time. How is my duty? Everything they are called. But I'm giving the advice for pray for all us and for me too. Two years हो गया, क्योंकि फर्स्ट जाने के टाइम में फर्स्ट कोविड आया था, उसके बाद गया नहीं है. फिर नेक्स्ट मंथ जाने के लिए कोशिश कर रहा था, मैं जाने के लिए सोचा था, बट अभी भी कोविड आ गया.
But Sherry is not alone. At the Max Hospital, 1,000 nurses are manning 3 shifts a day. They have 14 days of continuous COVID duty and 4 days of quarantine. Nurses travel at least 10 to 15 kilometers every single day to reach work. In Uttarakhand's Almora Medical College, 33-year-old Jitendra is the lone microbiologist. For the past 6 months, he alone has been testing over 900 samples a day.
जैसे हम लोग सर यहाँ पे मैं और मेरी टीम, हम लोग, मेरा टेक्निकल स्टाफ और नर्सिंग सैंपल कलेक्शन नर्सिंग स्टाफ सब लोग मिलके 9 बजे से लेके सुबह 9 बजे से स्टार्टिंग हो जाती है, 8 बजे से शाम के 9-10 बजे तक हम लोग रिपोर्टिंग डिस्पैच कर सकते हैं. हमारा मेन उद्देश्य यही है कि सर जल्द से जल्द हम लोग रिपोर्ट डिस्पैच करें, जिससे कि ये संक्रमण कम से कम फैले.
In Surat, Dikshita, an emergency medical technician, has been toiling hours every day, managing her family in her little free time. She had shot to limelight during the first wave last year when she kept doing her job while being pregnant.
मैं 12 घंटे यहाँ पे ड्यूटी पे आती हूँ, घर पे जाके पूरी सैनिटाइजर फ्रेश होके ही मेरे बच्चे को गोदी में लेती हूँ, उससे पहले उसको टच भी नहीं करती. और मुझे गर्व है, मैं 108 में EMT की पोस्ट में काम कर रही हूँ. मेरे को सेवा का एक दूसरी बार मुझे मौका मिला है, इसमें मुझे गर्व है.
India salutes these unsung heroes in the battle against coronavirus. With Aishwarya Paliwal in Delhi, Jitesh Tripathi in Uttarakhand, Bureau Report, India Today.